Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island. And today I wanted to talk a little bit about Zone 2 exercise. So I get a lot of questions about this from my patients and folks out there in the world. So I wanted to discuss what it is, how to measure it, why should we do it, just very briefly. So zone 2 is where we are going to maximize burning of fat. So that's either by lipolysis, breaking down the fat itself, but also oxidizing fat in the mitochondria. So we're trying to utilize the mitochondria, develop their efficiency, and be burning fat as we do it. And this is benefiting our baseline cardiometabolic fitness. And so it can be contrasted with your maximum cardiac output or maximum aerobic utilization, which is the VO2 max. How much oxygen can you utilize per minute, which is a measure of really your peak ability in terms of aerobic exercise. But I want to talk about zone 2 because zone 2 really, for most folks, it ought to be about 70 to 80% of the total amount of time that you're able to dedicate to aerobic exercise. Strength training, just aside for the moment, but of course we should be doing some of that. But so how do we estimate it? Well, it's really kind of easy and it doesn't need to be very technical. So what I recommend for patients is really to just assess their perceived level of exertion. And that really means if you can hold a conversation, but you're out of breath to the point where it's uncomfortable to have a conversation. I don't recommend that people, really try to calculate their maximum heart rate and then, do 70 to 80% of that and so forth. It's not really necessary because perceived exertion is really, really quite good for this purpose. So you could be on a bicycle, you could be on a treadmill, an elliptical, whatever form of basically consistent steady state exercise you can do where you feel a bit out of breath, you can hold a conversation, but it's uncomfortable to do so. It is good to have at least 30 minutes a few times a week doing this. If you can get 150 minutes per week in, that's great. It's good to divide it up. If you're doing more than 30 minutes, to make it at least in 2 sessions. You can do 30 minutes, 45 minutes, even an hour if you have a pretty high volume of aerobic exercise, a large portion of time that you're able to dedicate to that during the week. But this is really important for developing your baseline aerobic fitness. We also, of course, want to work on that peak VO2 max as well, but we can talk about that another time. So, and 80% again of what you do for cardio, that 70 to 80 ought to be what you're shooting for, to be at this steady state exercise level that we call zone 2. So again, everything we share on these podcasts together and videos is for educational purposes only. No doctor-patient relationship has been formed. And if you have particular questions, concerns, particularly about starting exercise, if you're not really engaged in it now, then please don't hesitate to reach out to your medical professionals. If you'd like to talk to us about how we can optimize your health in our concierge-style practice, please reach out to the office, 516-604-3418, online at northeastmedicalpractice.com. And of course, you can learn more from all of our social media outlets, our YouTube channel, where I have all these videos housed, and also my Longevity MD podcast on Spotify. But until we see each other next time, be in good health and do that zone 2.